Hi, this is Sarah Rudolph with Vital Life Physical Therapy and Wellness in Longview, Texas. Today I want to address the subject of an excessively curved lower back and what you can do to help relieve pain and tightness if you are somebody who has that very strong and deep lumbar lordosis, which means that your lower back has a very deep curve in it. So, what is very important in people that have that is a lot of times they also have their pelvis tilted forwards and they have tightness in the hip flexor muscles in the front of the hip. So, it is important to stretch those hip flexor muscles and release them as well. But today I want to just focus a little bit more on the back rather than the front. So a really nice home exercise that you can do if you are somebody that has that deep lumbar curve and has some back pain at the end of the day, especially if you've been doing a lot of standing, is to just lie on the floor like I am this evening, and you can roll over onto your back and bend your knees to a comfortable distance. This will immediately kind of relieve your back, but I have seen people that are so tight that the back does not even reach down onto the floor when they lie like this. So what you would do in this position then is just to do a posterior pelvic tilt, which means you're tilting your tail up towards the ceiling, really, if you were thinking about a tail coming out from the end of your spine, and kind of like a dog tucks his tail in between his legs when he gets in trouble. That's what we're doing here. So we're using the lower abdominals to tilt the pelvis backwards, and then that helps to flatten out the lower back and relieve the strain on those joints and muscles that have had a lot of compression and strain on them during the day, keeping you upright. So I would do a series of pelvic tilts, just tilting all the way back as far as you can go, holding it for a couple of seconds, and then just releasing gently back down. That's going to just help to grease the joints, as it were, just giving that bit of movement, creating some space there, and then releasing that. So you could do a couple of sets of 10 of those, just getting those joints moving, flattening out the back. And then you can also do a single knee to chest stretch. And you may want to hold that for a good minute or so. That's going to again help to flatten out and give a stretch around the back of the hips, but also in the lower back. Or you may feel really nice bringing both knees up towards your chest. When you have that deep lumbar curve, bringing both knees up helps to flatten it out and give a gentle stretch to the muscles on either side of your spine there in your lower back. So again, I would hold this for at least about 90 seconds to 3 minutes to give those tight muscles and their connective tissue, the fascia, enough time to release and actually create some length, which is what you're wanting. And then you can always come down slowly out of that position. The third thing that I would recommend you do is get something like an inflatable ball, or even a large pool noodle that you can cut into segments. Would be great to put up underneath your sacrum. That's that triangular flat bone right at the end of your spine. And you can settle down onto the ball there and just allow, again, just a slight posterior pelvic tilt. So almost roll the ball slightly more towards where your tail would be coming out of your spine to allow that lower back to just completely relax down towards the floor there, and that'll help to just more passively open up those joints there. And I would recommend that you keep your knees bent, either like this with your feet flat on the floor, or for added relaxation you could put a couple of pillows underneath your knees, or even elevate them on a chair. So you can be comfortable enough to relax in this position for a good 5 minutes or so, and that should really bring some relief and ease to your lower back muscles and joints there if you are one of those people who has a very arched lower back, which means that you're going to be having a lot of compression on those joints during standing activities during the day, and those muscles get really tight from holding you up in that position. So I hope that helps. Feel free to share this video with friends or family members or co-workers who may have spoken to you and said something about having some lower back pain, especially if they do have a deep curve in their lower back. And if you have any questions or other things that I can answer for you, please feel free to contact me here in the comment section or via email. Thanks for watching. This is Sarah Rudolph with Vital Life Physical Therapy in Longview, Texas.